Hi, my name is Marlo Klein, and today I'm going to discuss antihypertensive medications used for the treatment of hypertension in patients that are on hemodialysis. First, I'm going to start with our objectives. So the first objective is, by the end of this lecture, to describe the pathophysiology of hypertension in the hemodialysis patient. Second objective is, by the end of this lecture, to be able to identify the two classes of antihypertensive medications that are used as the first-line treatment in hypertension in hemodialysis patients. The third objective is to be able to compare and contrast the other antihypertensive medications used in this patient population, hypertensive patients that are on hemodialysis. Okay, let's get started. Okay, next we're going to talk about the pathophysiology behind hypertension in the hemodialysis patient. First, some little fun facts. Hypertension affects 90% of patients on hemodialysis. This is so important because of cardiovascular health. Another fun fact is that only 30% of patients that are hypertensive and on hemodialysis have their blood pressure under control. So this is a main factor in why compliance is so important for these patients. First, I'm going to discuss pathophysiology of hypertension in the hemodialysis patient. Before I get started, I'm going to discuss a couple fun facts. Hypertension affects up to 90% of patients on hemodialysis. In addition, only 30% of hypertensive patients on hemodialysis have good control over their blood pressure. This puts them at an increased risk of cardiovascular disease. So, some of the factors that lead to hypertension in the hemodialysis patient is volume sodium overload, the RAS system, renin-angiotensin-aldosterone system, and increased sympathetic nervous system activity. So a lot of these factors work together or separately to increase hypertension in the hemodialysis patient. According to the National Kidney Foundation, the goal for blood pressure control in the hemodialysis patient varies depending on what stage of dialysis they're in. So for the pre-dialysis patient, the goal is to keep their blood pressure under 140/90, and then after dialysis to keep the blood pressure under 130/80. How we achieve this is through non-pharmacologic methods and medications as well. So some of the non-pharmacologic treatments include fluid and sodium restrictions. It's recommended that the hemodialysis patient doesn't intake more than 2 to 3 grams of sodium per day and maintain the fluid restriction between 1,000 and 1,500 mLs per day. As for medications, the National Kidney Foundation suggests that medications that inhibit the renin-angiotensin-aldosterone system, the RAAS system, should be the first-line treatment. So this includes angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, and angiotensin II receptor blockers, or ARBs. We'll discuss those in a little bit. The first-line treatments for hypertension in the hemodialysis patient include ACE inhibitors and ARBs. ACE inhibitors have some side effects, such as cough and erythropoietin resistance. Also, the ACE inhibitors are mostly removed during hemodialysis. For the ARBs, they have similar results as the ACE inhibitors, but have better side effects. There's a decreased risk of that dry cough that's associated with ACE inhibitors typically, and also there's no issue with erythropoietin resistance. So we just discussed that ACE inhibitors and ARBs are the first-line medication treatments for hypertension in hemodialysis patients. There are many other medications available, however. First ones are beta blockers. Beta blockers are typically recommended to be taken with an ACE inhibitor, especially in those patients that have congestive heart failure. The downside to beta blockers is that they are dialyzed and they might require supplemental additional dosing after dialysis. The next medication are combined alpha-beta blockers. So these are effective in reducing blood pressure. They're more affordable than other classes, and there's an increased incidence of drug intolerability, however. They have side effects such as hypotension, bronchospasms, and bradycardia. Some of these medications, such as carvedilol and labetalol, can also cause fasting hypokalemia. The good thing about these is that they're only partially dialyzed, so the patient probably won't require that extra supplemental dosing like is seen in the beta blockers. The next medication is the calcium channel blockers. These medications are not dialyzed, and it's only once daily dosing, so that's a good advantage to these medications. Next, we have the alpha adrenergic blockers. These are reserved for those patients on hemodialysis with resistant hypertension. So the other medications haven't worked at this point. That's when these medications will come involved. The other class of medications here is a central nervous system sympathetic agonist. An example of this is clonidine. This is used less frequently due to the side effects that patients don't like experiencing. Some of the side effects include dry mouth, fatigue, rebound hypertension, and erectile dysfunction. The other class of medications are vasodilators. Some examples of these are hydralazine and isosorbide. These are reserved for those patients, again, with resistant or refractory hypertension. These require more frequent dosing, so a little bit more difficult to maintain compliance in those patients that are already having difficulty maintaining their blood pressure. So in summary, the first-line treatment for hemodialysis patients that are hypertensive include ACE inhibitors and ARBs. Other medications available for these patients include beta blockers, calcium channel blockers, vasodilators, and the other antihypertensive medications. Every medication has side effects and benefits, so it's important for these patients to discuss with their physician which one works best for them based on their side effects and the results of the medications on their blood pressure. Next is some non-pharmacologic treatments. This is important also for nursing education to provide to the patients and their families. Things like fluid restriction and sodium restriction and compliance with medications. Again, compliance is super important in these patients, and it's important as nurses that we're educating patients on their medications, the reasons that they need to take them, remain compliant, and also other things that they can do in their life to maintain their blood pressure within a normal range for them. Thank you for your time. I appreciate discussing hypertension in the hemodialysis patients. Thank you.